Hi, I'm Dr. Castillo-Sang. I'm a heart surgeon here at St. Elizabeth and Edgewood, and I'm here with Ruth, and we're going to show you how endoscopic cardiac surgery works. We're one of two centers in the country performing totally endoscopic cardiac surgery with a 3D endoscope. So now we're going to show you how we use the endoscope to perform open heart surgery through a very small incision. This is the working port, and as you can see here, this is the object, the heart. Now, the heart would be a little closer in a real person than this image is showing us. But with these instruments, we're able to suture and apply different techniques. For example, in this particular case, suturing through here, all endoscopically, right? The instruments are long shafted. These are 12 to 14-inch instruments. In this particular case, we're applying a stitch to the left, to the right atrial appendage. This is, of course, a model that's been in a 5th grade classroom, so bear with us. Using these instruments at first appears to be counterintuitive because they're long shafted and straight, but the reality is that the endoscope allows us to see detail that we could have otherwise missed using our own eyes in direct vision. For that, I would have to show you footage of an operation, and this is how we do endoscopic cardiac surgery with a 3D endoscope. The 3D endoscope profile cannot be shown because, of course, you need to have the special glasses, for example, to observe the different things that we want to show you. So now let me show you what endoscopic cardiac surgery is all about. As you can see from our setup, there is a small incision to transit in and out instruments, as well as the prosthesis that we're going to use for the operation. The scope goes in a 10mm port, and that's it. We'll have a perfusionist on the other side and a male nurse, Ruth, here today, and we'll perform the operation standing or sitting right next to our patient. What that brings is the ability to solve or troubleshoot issues that may arise during the conduct of the operation. The heart-lung machine is connected to the patient, and me being able to see what's happening and communicating with a perfusionist allows me to take action or correct actions when needed. So let's take a look. We're going to go from 2D onto 3D, and what you will see in your screens is just basically a blurry object, but what I'm seeing is a three-dimensional picture as when you're in the movies. So the depth perception is incredible. I can see what things are close to me as opposed to things that are further away from me, and that distance your brain can compute very easily. So this allows the surgeon to perform different actions that altogether allow for a faster and safer operation.